This is another presentation by My Weight World. Exercise, the physiology of stretching. The purpose of this presentation is to introduce you to some of the basic physiology components at work when a muscle is stretched. These include muscle composition, how muscles contract, connective tissue, cooperating muscle groups, the stretching function, and components of a stretch. Muscle composition. Muscles and bones comprise the body's musculoskeletal system. Bones provide posture and structural support for the body. They are connected by the joints, which are connected by ligaments. Muscles allow the body to move by contracting and thus generating tension. They are attached to the bones with tendons. The musculoskeletal system also provides protection for the body's internal organs. Everything comes together when the nerves connect the muscle to the spinal column at the neuromuscular junction. Muscles vary in shape and in size and serve many different purposes. Large muscles, like hamstrings and quads, control the motion of the body. Specific smaller muscles, like the heart and inner ear muscles, regulate blood flow and facilitate balance. At the microscopic level, all muscles have the same basic structure. Muscle contraction. When a muscle fiber contracts, it contracts completely. There is no such thing as a partial contracted muscle fiber. As muscle movement occurs, the proper number of fibers needed to perform the specific action are recruited. No single muscle fiber is able to vary the intensity of its contraction relative to the load against which it acts. Rather, the more muscle fibers that are recruited for any given movement, the stronger the force generated by the muscular contraction. Connective tissue. Connective tissues consist of tendons, ligaments, and the fascial sheaths that bind muscles into separate groups. Composed of a base substance and two kinds of protein-based fibers, connective tissue is located around the muscles and muscle fibers. The base substance acts as both a lubricant, allowing the fibers to easily slide over one another, and as a glue, holding the fibers of the tissue together in bundles. The more elastic the connective tissue around a given joint, the greater the range of motion for that joint. Connective tissue helps provide suppleness and tone to the muscles. Cooperating muscle groups. When muscles cause a limb to move through its joint's range of motion, they usually act in the following cooperating groups. Agonists. These muscles cause the movement to occur. They create the normal range of movement in a joint by contracting. Agonists are also referred to as prime movers, since they are the muscles that are primarily responsible for generating movement. Antagonists. These muscles act in opposition to the movement generated by the agonists and are responsible for returning a limb to its initial position. Synergists. These muscles perform or assist in performing the same set of joint motions as the agonists. Synergists are sometimes referred to as neutralizers because they help eliminate or neutralize extra motion from the agonists to make sure the force generated works only within the desired plane of motion. Fixators. These muscles provide necessary support to assist in stabilizing the rest of the body while movement occurs. Fixators are also sometimes called stabilizers. As an example, when you flex your knee, your hamstring contracts and, to some extent, so does your calf and lower buttocks. Meanwhile, your quadriceps are inhibited, relaxed, and lengthened somewhat, so as not to resist the flexing. In this example, the hamstring serves as the agonist, or prime mover, the quadriceps serves as the antagonist, and the calf and lower buttocks serve as the synergists. Agonists and antagonists are usually located on opposite sides of the affected joint, like your hamstrings and quadriceps, or your triceps and biceps, while synergists are usually located on the same side of the joint near the agonists. Larger muscles often call upon their smaller neighbors to function as synergists. The following is a list of commonly used agonist-antagonist muscle pairs. Pectorals latissimus dorsi, or pecs and lats, anterior deltoids, posterior deltoids, or the front and back shoulder, trapezius deltoids, or the traps and delts, abdominals, spinal erectors, or the abs and lower back, left and right external obliques, or the sides, quadriceps hamstrings, shins calves, biceps triceps, forearm flexors extensors. Muscle contraction does not necessarily imply that muscle shortens. It only means that tension has been generated. Muscles can contract in the following ways: isometric contraction, or a contraction in which no movement takes place because the load on the muscle exceeds the tension generated by the contracting muscle. This occurs when a muscle attempts to push or pull an immovable object. Isotonic contraction, or a contraction in which movement does take place because the tension generated by the contracting muscle exceeds the load on the muscle. This occurs when you use your muscles to successfully push or pull an object. Isotonic contractions are further divided into two types: concentric contraction, during which the muscle decreases in length, shortens, against an opposing load, such as lifting a weight. During a concentric contraction, the muscles that are shortening serve as the agonists and therefore do all the work. Eccentric contraction, during which the muscle increases in length, lengthens, as it resists the load, such as lowering a weight in a slow, controlled fashion. During an eccentric contraction, the muscles that are lengthening serve as the agonist and do all the work. What happens when you stretch? The stretching of a muscle fiber begins with the sarcomere, the basic unit of contraction in the muscle fiber. As the sarcomere contracts, the overlapping area between the thick and thin myofilaments increases. As it stretches, this area of overlap decreases, allowing the muscle fiber to elongate. Once the muscle fiber is at its maximal resting length, further stretching places force on the surrounding connective tissue. As the tension increases, collagen fibers in the connective tissue align themselves along the same line as the tension force. So when you stretch, the muscle fiber is pulled out to its full length and the connective tissue takes up the remaining slack. As a muscle stretches, some of its fibers lengthen, but other fibers may remain at rest. A muscle's current length depends on the number of stretched fibers. The more fibers that stretch, the greater the length. Proprioceptors are the nerve endings that relay all the information about the musculoskeletal system to the central nervous system. They are the source of all perception of one's own body position and movement. Proprioceptors detect any change in physical movement or position, as well as any change in tension or force within the body. They are found in all nerve endings of the joints, muscles, and tendons. The proprioceptors related to stretching are located in the tendons and in the muscle fibers. There are two kinds of muscle fibers: intrafusal muscle fibers and extrafusal muscle fibers. Extrafusal fibers are the ones we generally mean when we mention muscle fibers. Intrafusal fibers, also called muscle spindles, are stretch receptors and are the primary proprioceptors in the muscle. The stretch reflex. As the muscle stretches, so does the muscle spindle. As it stretches, the muscle spindle notices changes in the muscle length and signals the spine with this information. The stretch reflex is then triggered, which attempts to resist the change in muscle length by causing the stretch muscle to contract. The more sudden the change in muscle length, the stronger the muscle contraction. One reason to hold a stretch for a prolonged period is that as you hold the stretch, the muscle spindle becomes accustomed to the new length and reduces its signaling. As a result, you can gradually train your stretch receptor to allow greater lengthening of the muscles. The stretch reflex has both a dynamic component and a static component. The static component of the stretch reflex continues for the duration of the stretch. The dynamic component of the stretch reflex lasts for only a moment and occurs in response to the initial sudden increase in muscle length. When muscles contract, they produce tension at the point where the muscle connects to the tendon. When this tension exceeds a certain threshold, it triggers the lengthening reaction, which inhibits the muscles from contracting and causes them to relax. Another reason for holding a stretch for a prolonged period of time is to allow the lengthening reaction to occur, thus helping the stretched muscles relax. It is easier to stretch or lengthen a muscle that is not trying to contract. In summary, you now have a basic overview of the muscles involved and how they work while stretching. Things to remember. Together, muscles and bones make up the body's musculoskeletal system. Although muscles vary in shape and in size and serve many different purposes, they all have the same basic structure. Groups of muscle fibers create movement. The number of fibers recruited for the movement determines the force of the movement. Connective tissues consist of tendons, ligaments, and the fascial sheaths that bind muscles into groups. They provide suppleness and shape to the muscles. Muscle groups work together to cause a limb to move through its joints' range of motion. Muscle contraction can result in the lengthening and shortening of specific muscles. A muscle's current length depends on the number of stretched fibers. The more fibers that stretch, the greater the length. One reason to hold a stretch for a prolonged period of time is so you can gradually train your stretch receptors to allow greater lengthening of the muscles. This has been another presentation by My Weight World.